Hi everyone, my name is Nathaniel Woody and the following is my skills blog. The skills described in Chapter 7 and on the leadership questionnaire that I would need to secure in order to get needed resources such as staff if I were a manager are as follows. I would need to identify the goals of our unit, including how to obtain positive patient outcomes and patient satisfaction. Other goals would be preventing falls, decreasing CAUTIs, and central line infection prevention. I would need to be able to work well with my employees to decide what resources are necessary for these goals. I would need to relay this information to the staff, provide implementation plans, and then be able to evaluate if these goals were met. I would be a participative manager because all of our sources relate this to positive patient outcomes and good staff retention rates. It makes staff feel valued. I would need to be available to staff, give employees autonomy, but also provide support. I would make sure we were not short-staffed. The leadership questionnaire indicated that I need to improve on problem-solving skills. I also need to learn more about planning, budgeting, and resource allocation as a manager. Also staffing, because I don't have much experience with that, and directing due to my lack of leadership experience as well. Secondly, I would use published literature to gain knowledge of these skills that I am lacking. I would also use it to stay aware of things changing in the healthcare setting. Additionally, there is a lot of research on effective communication between members of the interdisciplinary team and how to improve on this. I would use the research to implement practices like rounding on patients with all interdisciplinary team members, including doctors. This ensures everyone is on the same page, working on a common goal. And for third, the three departments I would need to work with as a manager are the chief nursing officer, as they would be my boss. Secondly, I would need to work with physicians to make sure there is good communication between the nurses and doctors and that they have a common plan together. Lastly, work with the ED because we get most of our patients from them, and in my experience, communication between the ED nurses and floor nurses has been difficult, and therefore I would try to implement an improved reporting between the two departments. And last, I prefer the vertical structure in hospitals. I only have experience working in this structure, and it seems to work well in the hospital. Everyone knows their specific goal and what task they should be performing. The nurses know what is expected from them. They know who their manager is and all have a clear understanding of the chain of command. I prefer matrix organizations because it's a team-oriented approach to working together collaboratively for a common purpose. And in a hospital, you have many different people that have various duties, but they all form the patient's interdisciplinary team. This method seems, to me, the most effective in the hospital. Okay, thank you guys.